A question I get quite often is, how long will this result last me? And that could be for a hair transplant, it could be for a fat graft, it could be for a facelift, it could be for almost anything out there. And I try to mention to them an analogy that would probably be the easiest way to digest the fact that it's permanent. I always say it's permanent minus further aging. So the problem with that minus further aging is, what does that mean? How fast is the acceleration of the residual issues? So what are things that, let me use an analogy first of all. So think of you as, let's say for a woman, if you did a facelift and a fat graft and you have an identical twin sister, and that identical twin sister also does not go in the sun, has the same lifestyle, same diet, same exercise, same stress levels, same job, does not smoke, has the same spouse or absence of a spouse. In other words, if we can try to control all environmental and epigenetic means things that can influence genetics, control all of those variables, then in 5 to 10 years, you should still look significantly younger than she will, but you will have aged, and there will be a progression of your aging. How do you minimize that aging? Well, for me, it's minimizing sun, and I'm going to do a video on that. It's about doing well with diet, it's doing well with stress reduction, whatever it may be. But what I do is essentially permanent. The fat that I grafted for you is permanently there. It is after 6 months to a year, whatever is there is not going to go away. I liken it to a skin graft. Someone puts a skin graft for a cancer, you don't question whether that skin graft will survive at a year. At a year, you don't question, is it going to go away? Now, the first week or two, it could have some compromise. But at a year, it's there for life. So that's why I want you to understand that what I do for you surgically, whether it's a fat graft, a facelift, or whatever, maybe is permanent. Hair loss is also very similar. If I put grafts up there, for the most part, minus some recipient influences, which I don't want to get into too much to make it more confusing, but in general, a hair transplant really is permanent. But you have native hairs around it, you can have progression around that situation. And how do you determine future progression? It has to do with past progression. So if you've got a very slow burning hair loss, that gives me the best prediction that in the future you'll have less need for it. Also, as you get older, your testosterone levels drop. I'm going to do a video about that. And if you cannot be on extra testosterone, that can help minimize the progression of hair loss. And if you can be on good medical therapy to stabilize things, it can help limit that as well. So longevity of most of the things I do really are permanent minus further aging. And what my goal is to minimize that minus further aging variable. Just like if a dentist says, look, don't eat candy because it's going to impact on your dental health and it's going to compromise it. It's the same thing when I do with facial stuff. It has a lot to do with sun and lifestyle. And when I do with hair, it's testosterone and the absence of medical therapy. So I want to give you a permanent and minimize that minus further aging variable so that you can get the best results at the longest lasting. But to understand it in context, if you had a twin sibling, whatever it may be, once those hair grafts take, once the fat graft takes, once the lift is already there, whatever is there is permanent, but it doesn't stop the aging process.